Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. They play a crucial role in healthcare but tend to be overlooked. Caregivers are often family members who will step in to provide daily assistance to sick patients and the elderly. They take on various tasks like bathing, feeding, and managing medications. Many lack access to proper training, leaving them vulnerable to stress, loneliness, burnout, and financial hardship. In a survey conducted in 2024 in the U.S., 71% of middle-aged Americans said they were caregivers for both their children and parents, a situation experts call the sandwich generation. Global data revealed that in Africa, over 70% of elderly care are provided by family members. Let's go to Zambia, where reporter Kathy Short sheds light on some of the challenges faced by caregivers in the country.
According to the Zambian Ministry of Health, professional caregiving is still in its infant stage. At the moment, it remains a preserve of the rich in the southern African country. A professional caregiver costs up to $4,000 a month, way too expensive for most citizens. The majority of Zambians rely on family members to provide care for sick loved ones. Most of these caregivers have no professional training. Lusaka resident Kelly's Mushota has been a caregiver for his mother, who was diagnosed with a stage 3 breast cancer in 2019. Mushota, who is the oldest son and breadwinner, had to take his mother into his home in order to better take care of her. He bore the cost for her care until she recovered. To raise the finances needed, Mushota had to take up 2 jobs and says he barely slept at night.
Our system does not give prior information of what to expect of the process, what's the cost, what's the next stage. So you can never know the cost of the entire process. You only get to look for the money when you get to the next stage. And I think that was very challenging. And it caused a lot of stress on myself, my siblings, and a few other people that were around to help.
Helen Mwale, who is also the oldest daughter, has taken turns being a caregiver for several family members. Recently, she looked after her 96-year-old aunt, whose illness left her unable to walk or do anything on her own until she died.
If I remember very well, I had even stopped going for work because I really needed to dedicate my time 100% to take care of my aunt. We had a few family members who would come in there and then, but not always. But I was 24 hours dedicated to taking care of her.
Happy Zulu is a therapist at Reveal to Heal Medical Center, a privately run counseling center. Zulu says most caregivers do not seek counseling to help them cope with the demands of their responsibilities.
But unfortunately, we have received very, very few people who seek therapy. Because in most cases, people don't even think these individuals exist, or well, they know they exist, but they don't think they need help also. But look, they go through stress, they go through burnout, and they could go through depression as well.
A 2023 UN report indicates that care work is essential for the functioning of households and societies, but it is often not recognized, paid, or appreciated. It adds that more needs to be done to support and recognize caregivers' vital contributions to health care. Kathy Short, VOA Africa, Lusaka, Zambia.